We're in Abu Dhabi at the 79th Annual FIP Congress, and I should say that workforce issues are a major concern, I think, in every profession, and mostly, maybe even more so, the healthcare professions. There's no one more qualified to talk about workforce issues than Dr. Tana Wuliji, who's with me here today. Tana is actually Technical Officer for workforce issues at WHO. Is that the official title, Tana?
Yes, very good. Thank you so much. I'm team lead at the moment for the Working for Health program in WHO and also the setup of the new WHO Academy.
Great. Now, it's a few years since we've talked, but it's even a greater number of years since we first talked. I think about 15 or 16 years ago when you were president of the International Pharmaceutical Students Federation. So things have changed a lot since then. Well, not so much changed, but progress. Tell us about your career path since.
Thank you so much. Yes, it has been a long time, and I remember those days when we actually went to FIP and the World Health Assembly, and you showed me what was going on and introduced to people, and I'll never forget that. So huge thanks for that, John. Indeed, since then we've come a long way in a number of areas, and my understanding and my advocacy on workforce has really built up, and it's fantastic to be here at FIP and see what has been done in pharmacy in the education and workforce space, how it's really revolutionised the policy discussion, the practice discussion, the science discussion, and I'm really excited to see that and to be part of it and to sort of put that as an example to other professions as well as we look at this in the broader healthcare context.
Mm-hmm. So you've been in Geneva now with WHO a few years?
Indeed. So I've been with WHO almost 4 years now. I first joined during the Ebola outbreak, looking at the workforce issue, given the number of health workers who died and who were affected, but also that that epidemic happened in countries that had a real scarcity of health workforce, and it was a very acute example of how important it is to address workforce as part of broader health issues.
Okay, so I guess gender issues are another part of the workforce problem. Is it a problem?
I would say gender equity is a core part of the workforce discussion. In health sector, we actually have more women employed in the health sector than many other sectors, and in fact 70% of the workforce are women. So I think we could say that gender issues are front and foremost of our considerations. However, it's been neglected for the longest time, and it's encouraging to see now many organisations, many professions stepping up to talk about it. One of the key issues we're really concerned about the fact that many health workers are women but are underrepresented in leadership and decision-making roles. Another key issue is the undervaluing of women's work. You know, women contribute $3 trillion annually to global health, but only half of that is actually formally recognised and paid. The other challenge is around working conditions, decent work, the pay gap, and so on, and the issue of sexual harassment, discrimination.
So they're issues that you're addressing at WHO?
Absolutely, and this is something we're really pushing forward with, particularly this year. We've got 2 major reports that came out earlier this year on those topics, and we've got a hub which has established a network with all different organisations and individuals, experts, policymakers, etc., trying to drive change in this space.
How do you see the collaboration between FIP and WHO?
The collaboration between FIP and WHO has been fantastic for many years, but especially on this issue of gender, FIP is one of the first organisations who stepped up to be part of the Global Health Workforce Network Gender Equity Hub, has been involved in all the different activities, was part of our Lancet commentary on gender transformative change, the literature review, and also the working group around making changes for pushing for equity. So I think FIP's taken its role very seriously, and it's great to see now that FIP is bringing its role into the organisation and spreading that more widely at the country and regional level.
Sure. I guess that's part of the role, isn't it? And a very important part to spread the word, not just talk about it here at congresses, but to get all countries, all member countries involved in those issues and be proactive.
Absolutely. I think it's a recognition that pharmacy is actually very central to this issue of gender for a couple of reasons. One, firstly, healthcare is predominantly women, and if you take pharmacy, it's one of the biggest professions in healthcare, and it's also one of the most trusted professions. It's also the first port of call for a lot of people in the community, and in that unique positioning, how can pharmacy push for gender transformative change? It has the opportunity to not just leverage small ripples of change, but also big waves of change across society, and I think that's the opportunity to be seized.
Well, WHO is more than just pharmacy, of course, but I know you're making sure pharmacy is front of mind at WHO. Tana Wuliji, thank you so much.
My pleasure.
This is John Bell reporting for FIP, Abu Dhabi 2019.